Hello. Okay, let me just share my screen. All right, so today I'm going to be talking about my research concerning the long-term effects of septal deviations. A deviated septum is basically the nasal septum down the middle of the nose is crooked, and that can cause minor and major symptoms. So my research question, I used the P code outline. So starting with the P, my patient or problem is patients aged 18 to 25 with deviated septums. The intervention would be septoplasty surgery, and the comparison would be those who do not have any surgery. The outcome is the number of developed comorbidities in each participant, and the time period I will be using is until the patients reach age 45. So my research question is, would septal surgery decrease the number of developed comorbidities in young adults with a deviated nasal septum compared to those who never have septal surgery? So those who choose to have surgery will have the normal septum, and those who do not will live chronically with the deviated septum, seeing if there's any symptoms or anything that develops. Today, the typical treatment of a deviated septum is first using decongestants. That is step one. If you're still having symptoms, step two is allergy testing and more intensive treatment to treat your specific symptoms. And then the last resort is a septoplasty, and that's still like a very elective and last resort procedure. So during didactic year, we learned about a lot about nasal passages and how it's important for them to be open, because if there's a decrease, you could have allergic rhinitis, chronic sinusitis, sleep apnea, obesity, migraines, and hypertension. This is also a picture of the procedure of a septoplasty. So basically they're changing it from deviated or crooked to straight. It is minimally invasive with short recovery time. So this is what the participants would have done if they choose to have the elective surgery. Certain ENT studies have shown that there is an 80% likelihood that in the US you will have a septal deviation. So this shows that it is incredibly common and the symptoms are usually minor, but it is something that people can live with for their entire lives. So my goal is to find the research gap. A lot of symptoms have been associated with a deviated septum, but it's hard to see when surgery is really recommended, whether those symptoms will turn from minor to major, and what is considered minor and major symptoms. My goal is to identify those connections. So by studying the certain comorbidities that might develop from those who never get the surgery or may still develop if you get the surgery, whatever the results will be, it will be easier to identify which comorbidities are more strongly linked with having a deviated septum. So we want to have earlier identification of the symptoms and also earlier surgical intervention, and combining those two to see if there will be decreased comorbidities by the age of 45 and an increased quality of life by having an open nasal passageway, making it easier to breathe and having less of those symptoms. My question is measurable because my variables that I'm measuring are the specific comorbidities developed for each participant by age 45. I'm not measuring the severity or how long they have been there or been present. I'm just seeing if they are present. So yes or no. And then these are the specific comorbidities that I am studying. I'm not going to look at the patient's entire medical history and attribute those to septal deviations. I'm going to attribute these 6 because this is what I have found in my peer-reviewed research to be strongly linked with septal deviations. So you can see them here: migraines, obesity, hypertension, allergic rhinitis, chronic sinusitis as well. My research question is feasible. I believe that I will have access to a sufficient number of participants by connecting with ENTs, family medicine, and pediatric providers. And as we showed before, about 80% of people in the US have a deviated septum. So I don't think it will be hard to find an adequate number. I also will have a feasible research question because I have an adequate timeline. I am giving my patients until they're 18 to 25 until 45, so about 20 to 25 years to see if their comorbidities will develop. I also will ensure that my research is ethical. I want to treat my participants with respect, have integrity, be trustworthy. I want to make sure that they are very knowledgeable and aware of what the research process will entail, whether they get surgery or whether they do not. I will incorporate informed consent, making sure that the patients know exactly all of the details and the aspects of what this will entail. I will follow HIPAA and make sure I will maintain patient confidentiality. As I will have access to their medical history, I will make sure to use that only for my research project. And then I also want to emphasize the importance of a patient's choice. So I don't want to ensure that some participants have the surgery and some don't. I want them to be able to choose on their own, and hopefully I will have equal amounts of both groups. So after all of our assignments in Grad Project 1, my refined research question is below. I would just really like to find the significance and how this could potentially benefit those with deviated nasal septums by better preparing for providers to have a better idea of the treatment for that. Thank you so much.